Hey, it's Jessica DeMassa with WTF Health. We have a new startup that we are talking to over here. This is the CEO and co-founder of HealthSnap. Her name is Yenvy Truong. Kat, great to have you with us. Tell me a little bit about HealthSnap. What do you guys do?
Hi, Jessica. Thank you. HealthSnap, what we do is we take wearable sensors, apps, data from all lifestyle devices, device agnostic, and we make sense of it so that patients and doctors can have the same conversations. We create a standardized lifestyle profile so that healthcare providers, health systems, corporate wellness can look at it and have the same conversation across the board with patients.
This is so cool. So I love this idea of a lifestyle profile. Like, this is so neat. So what kind of information is in there? I mean, you said you're taking all of the stuff that we're getting off of our wrist or off of the ring trackers or whatever, any of that other stuff, and you're pulling all of that in. So what does it look like when it's actually in the lifestyle profile?
Well, we really look at the aesthetics, especially when the patient's looking at it. And because the physicians and a lot of these healthcare systems don't know what lifestyle really is per se from these wearables and Bluetooth devices.
Right, you're getting like one-off information.
Exactly. We create indices like metabolic, physical activity levels. We take all the data and normalize that data, and then we put it in a way that everybody can understand, meaning that if you have cardiovascular risk, metabolic risk, nutritional values, we break that down and we create something that's aesthetic, has gradient scales and compasses and whatnot, so that the doctor can look at it, the patient look at it, and they're on the same page.
This is so cool because this is a big pain point right now in healthcare. It's like we've got all these different devices that are tracking us, either through wearables or even things now in the home that can kind of pick up some information like ambiently. And and the thing is that doctors are really challenged. What do I do with all of this data? I mean, and sometimes they frankly don't want to see it. It's like, yeah, that's great. You walked your 1,500 steps or whatever, but what does that mean to me? So it sounds like what you're doing is you're really creating something that's useful in terms of bringing all this data together. Why tackle this right now?
Well, you have to look at physicians, for example. They never had the opportunity in medical school to look at nutrition and exercise and some of the behavioral aspects that we're seeing right now relating to chronic disease. So coming from data, having data scientists that's driven in exercise, nutrition, and understanding how to move an individual, for example, that's what really adds a dimension to what we do with the data. And then giving that in an ability for somebody else, on almost a lay person, with that information to understand, so they can effectively have a conversation with their patients or whoever they're servicing.
So your customer is the clinician at this point, right? I mean, you're looking to work with health systems. You even said employers in there. Why focus on that side of the healthcare system?
We started off with physicians because we knew that physicians are the pivotal individuals that would change a person's life.
This is a smart move.
Yeah. and a lot of companies try to bypass the physicians, and we knew that the physicians, if a physician told you to do something, you're more likely to do it. And so we're now at this point in the industry where patients are going to the doctors and asking for help with all this wearable data, and physicians are starting to ask about it and think about it. And so we're at a great point in time where we're able to service the provider of the patients and give them the need that they're asking for.
This is so smart to help them kind of bridge that gap into, like, you know, what the future looks like for the clinician. That's awesome. I wanted to ask about HealthSnap as a company. You guys are a startup, so give me a sense of where you're at. How big are you? Where are you based? How much money have you raised so far?
So right now we have about 12 health systems in our pipeline that we're having conversations with, and moving into contract phases right now. Over 500 physicians are using our platform right now, and we're very lucky in the fact that CMS and a lot of incentivizations are coming into the market to help providers adopt our platform and be incentivized and be reimbursed for what we're offering. Right now we're raising $10 million in a Series A to build out the infrastructure so that we can support the health systems.
That's awesome that it's reimbursable. I mean, I think that's going to help you a lot. That's a key point there. How big is your team?
Over 20 right now.
Oh, wow, good. And you were based in?
Miami, Florida.
Ooh, that's interesting. You don't get a lot of big startups from Miami, so that's exciting. Good news.
We're moving that in a great direction right now.
Awesome. Well, Yenvy, thank you so much for stopping by and chatting with us. Best of luck. If you guys want in on this A round, you heard it here first. This is the time to do it. Yenvy from HealthSnap, thanks so much for joining us. It's a pleasure to talk to you.
Thank you very much.
Thank you. I'm Jessica DeMassa with WTF Health. Thanks so much for watching.